A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
Chronic pain, dysfunction, and poor sleep can make it difficult to enjoy your life to your full potential, and also difficult to get a good night's sleep. The National Sleep Foundation says 1 in 5 Americans suffer from chronic pain and 1 in 4 Americans have a sleep disorder. One type of pain people may suffer from is due to TMJ. This can cause face and ear pain, aching teeth, a clicking or locking jaw, and headaches. On today's episode of your Hometown Health Connection, I'll sit down with Dr. Jeffrey Goldberg of facial pain and apnea. We'll discuss TMJ, snoring, and sleep apnea, and we'll also tell you about a non-invasive treatment to treat TMJ. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. Face pain, ear pain, tension headaches, teeth grinding, and jaw clenching are all just some of the symptoms of TMJ. A custom-fitted mouthguard can provide some relief. Here to answer your questions surrounding TMJ disorders, snoring, and sleep apnea is Dr. Jeffrey Goldberg of facial pain and sleep apnea. Dr. Goldberg specializes in non-surgical therapy for TMJ disorders, headaches, chronic facial pain, sleep apnea, and related disorders. Dr. Goldberg completed a specialty residency in facial pain in the University at Buffalo School of Dental Medicine, where he now teaches as a clinical assistant professor and supervises the TMJ clinic. He's one of few private practitioners in the country to have graduated from an American Dental Association accredited program in this field. Dr. Goldberg, welcome. Thanks so much for coming.
Thank you for having me, Samantha.
Now, at your clinic, you offer a holistic approach. You even have a physical therapist, a nutritionist, all in the office. Tell me a little bit more about what you do and how you differ from other practices.
Sure, thank you very much. Yes, I'm very fortunate to work with some really excellent people who are wonderfully educated and varied in what they bring to the management of facial pain, headaches, TMJ disorders, and sleep. My practice is located in the Dent Tower, a landmark building in Amherst, home of the Dent Neurology Group, and just to be in the company of that distinguished neurology group is really very helpful to me and to the patients that we serve. Plus, as you mentioned, we do have that great team within my own staff of wonderful assistants, hygienists, other dentists, and administrative staff. Really, I set out to create the ideal oral-facial pain practice, sort of a role model version, and I'm pleased to say I think we're doing that.
Definitely sounds ideal. How great is it to have everything all in one house? Now, tell me more, what is exactly TMJ, and what is it like for someone who has it?
Sure, so we use the term TMJ, which actually stands for temporomandibular joint, which is simply the name of the joint here where the jaw and the skull connect. So the term TMJ disorder implies something is not right with that joint, whether there's pain, sometimes sticking, clicking, some sort of functional disturbance, the bite feels off. When something is not right and is uncomfortable to the patient, then they may have a TMJ disorder, maybe something that we can help them with.
Talk to me a bit more about the symptoms when it kind of passes that threshold where I have to see you.
Sure. So when a TMJ problem becomes a problem is when you maybe want to start talking to your dentist about it. That's the place to start, or your medical doctor, physical therapist. But for most people, it's going to start with their dentist, and most dentists do have a pretty good knowledge about TMJ conditions as a starting point. But when it really becomes a problem, when it's interfering with your life, when it's making you uncomfortable, painful, certainly nobody should be living with pain if they have the opportunity to do something about it. If you're waking up, and often it is waking up with headaches or jaw pain, real stiff, can barely move your jaw in the morning or feels mechanically locked, you shouldn't have to endure that. If you have the opportunity to have that assisted with, I really encourage you to do that. If I mean, I hate to say it, some people feel really kind of embarrassed because their jaw clicks, and it actually kind of upsets the people that they eat lunch with and things like that. So we hear a lot of different versions of this, but to put it simply or succinctly, Samantha, if it's bothering you, I'd like the opportunity to try to help you with that.
Absolutely. Now, if you're a grinder, if you find yourself grinding your teeth when you're sleeping, is that a warning sign?
It is a warning sign. The correlation of clenching and grinding, and frankly, Samantha, the clenching is a lot worse than the grinding. Grinding is real bad for the teeth, but the clenching is real bad for the joint. Those have always been sort of classic signs and symptoms of TMJ, and it's certainly something to talk to the dentist about and consider some treatment.
Okay, Dr. Goldberg, I've had enough. I can't take the pain. I need your help. What is it like when I come to your office? What is that appointment experience like? And how do you diagnose me if I have TMJ?
Sure. You know, it's thank you for asking. It's a boutique style practice, I like to say. We are kind of quiet and low key. It's not a real busy office. It's a sort of unique office in that there are very, very few orofacial pain providers really anywhere, including here in Buffalo. So we kind of fit a very succinct little niche. And we really, really pride ourselves on the hospitality aspect of what we do. We appreciate that our patients are coming to see us. They're making this choice towards wellness, towards making their lives better. You know, TMJ is not a fatal condition.
Right.
Sleep apnea, you know, has a greater health risk element, and I know we're going to talk about that, but TMJ is, nobody dies of TMJ per se. It can be a very miserable condition. And for those that make this choice to treat it, to do this for themselves, we honor that. We want it to be a very welcoming, very pleasant experience. I'm a dentist that doesn't use a drill and doesn't you know, have a lot of causing pain. I hate to say that about dentists, but it's all about alleviating pain in our practice, and we certainly
who likes drills, that. Right? This sounds like more so a spa-like experience for TMJ and sleep apnea treatment.
Some people certainly have said so, yeah.
So tell me about the options in treating TMJ. I know you have some great devices there that you could show our audience.
Sure. This is fairly typical of the kind of mouthguard we would make on the model of some teeth here. And it's a 3D printed mouthguard. That's really sort of the state of the art here, something that we've been fortunate to be able to bring. In fact, actually, because of the pandemic, I had some time to learn that technology and bring it here to Buffalo. And so we're able to really control the process start to finish with a 3D printed mouthguard. We do lots of different kinds of mouthguards that do different things. The traditional night guard that a dentist may use for sleep apnea does help a lot of people, but sometimes you do need specialty care with something more specific to the need. A lot of our mouthguards are worn during the day, not just at night, and of course we have to accommodate that situation. And then we do get into some things we touched on earlier: physical therapy, nutritional counseling. We have cold laser therapy, ultrasound, ionophoresis, Botox, and other injections that we do, medication when it's necessary. So there's quite a few things we can do to help people with this kind of pain.
So this mouthguard, is this one that I would wear to sleep and help me prevent from grinding when I'm sleeping?
Yes. So this kind of mouthguard, you used a very important word there, which is prevent. A lot of mouthguards are really designed to shield the teeth. They protect them from the grinding, which again is very valuable.
Right.
I'd much rather see somebody grind a mouthguard than do damage to their teeth, grind their teeth. When we do this kind of guard that I have in my hand now, where it's so textured and it really directs the bite into a different rest position, different posture, we actually see a relaxation in the muscles where people tend to clench and grind less. So we're actually really preventing, as to use your word, that very thing which is so destructive.
It definitely sounds like you have a holistic type practice. You offer many elements, a combination of treatments with the physical therapy, nutritionist, and the mouthguard. Why don't other dentists do this?
The field that I'm in, orofacial pain, was just recognized, a very exciting thing for me and people in my field, just recognized less than a year ago. It was right at the depths of the pandemic at the end of March, something that's been in the works for literally decades, that orofacial pain became the newest specialty under the American Dental Association, which now has 12 specialties, and we are number 12. So orofacial pain specialists are very few and far between. I would estimate in all of New York State there's maybe a dozen or so. And of course, most of those are in New York City area. So this is just a very underserved area of medicine and dentistry, and it is now fully appreciated as a distinct specialty. So what I do is very different from other types of dentistry. It involves a certain additional education and certifications and things, and it's just a different type of dentistry that doesn't fit with a lot of other dental procedures and practice.
Definitely is needed. Glad to have you here in Western New York. Now, tell me how this mouth guard differs from the ones you can get over the counter. What type of technology does this use?
Sure. So the mouth guard that we've been looking at in my hands here is a repositioning mouth guard. So most mouth guards tend to be very passive in how they're effective. They cover over the teeth. They create a barrier or a shield for the teeth. They help a lot of people. Most people will get nice relief working with their own dentist for a TMJ issue, and that's certainly a place to start. But when you need something more advanced, this type of mouth guard I've designed on some 3D modeling software, very specific intention as far as how it's going to influence the positioning of the jaw, and it is made on a 3D printer, which is really the state of the art in that field. It's an FDA-approved material on the 3D printer. One of my biggest pet peeves, I think, is when people buy mouth guards over the counter at a sports store or off the internet. We don't know what those mouth guards are made of. And if somebody's putting that in their mouth for 8 hours a night, chewing on it, grinding on it, that's a lot of exposure to something. So using FDA-approved material, something that really fits well, it's not going to move the teeth and do unanticipated damage, that's really pretty important.
Doctor, talk to me about TMJ and its relation to headaches. Is there a connection there?
TMJ disorders can really be a trigger for certain kinds of headaches, especially migraine headache, which is something we see a lot, of course, at the Dent Tower. It's a major, one of the biggest migraine centers in the country. And there's a particular nerve system, the trigeminal nerve system, that really directly connects these two parts of the body. So there's a very direct connection. But a lot of headaches, particularly what we call tension type headaches, these are headaches that affect the temples. They feel like a tight band around the forehead and that part of the head. It's often described that way as a tight headband. I see a lot of that as a TMJ issue, particularly involving what's called the temporalis muscle. It's a muscle that goes all the way up here at the temples, and it extends down to the jaws. It's involved in stabilizing, clenching, chewing, using the jaw. And it's a muscle that gets fatigued and sore and relates to these tension type headaches, we call them.
Wow, so if my headache is concentrated more so in the frontal or by my temples, it might be due to TMJ.
That's a very good possibility, yeah.
Facial Pain and Apnea has offices in Buffalo at the Dent Tower at 3980 Sheridan Drive, Amherst, Suite 401. Dr. Goldberg can be reached at 716-636-2222 or online at facialpainandapnea.com. Ahead, learn how TMJ is connected to sleep apnea and that terrible morning headache.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com. Welcome back to your Hometown Health Connection. I'm Samantha Latshaw.
With me is Dr. Jeffrey Goldberg of Facial Pain and Apnea. Do you or your partner suffer from sleep apnea? Sleep apnea is a dangerous chronic disorder in which a person stops breathing several times per hour while asleep. This results in very poor sleep and can have serious consequences. For people who can't use a CPAP machine, an oral appliance may be the answer, but there are very few dentists in Western New York that offer them. Today we have our expert in sleep apnea and TMJ in studio with us to tell us more. Dr. Goldberg, thank you for being here with us.
Thank you, Samantha.
Untreated sleep apnea is associated with stroke, hypertension, diabetes, increased chance of automobile accidents. Now, tell me how sleep apnea and what signs do they show when perhaps you have an early sign of sleep apnea?
Sure. Thank you. The points you're making are very salient, and it really is a serious health consideration. When you consider that a person stops breathing, their airway falls closed and they cannot breathe with some frequency at night, imagine what that does to the body. The body is so reactive to that. It's such a life-threatening moment when a person can't breathe. The body really gets amped up and you kick in this fight or flight response. And no surprise, if that's happening multiple times an hour, every few minutes, that really takes its toll on the body. Snoring is often associated with sleep apnea. It's not a perfect association. Not everybody that snores has sleep apnea, but it's certainly a concern. What would concern me the most is somebody who visibly stops breathing. If you see a spouse or a parent, somebody in your family that stops breathing, you see that appearance, they seem to cough and gasp for breath while they're sleeping, that's a pretty strong sign of sleep apnea.
As a dentist, why do you treat both TMJ and sleep apnea together?
Sure. That's a great question. The specialty I'm in, orofacial pain, has traditionally included sleep apnea within our field. I think a lot of that has to do with our focus on more general health issues, pain and poor sleep, things that expand well beyond the mouth and the teeth. It also has to do with the fact that we treat them in a similar way. We make mouth guards for sleep apnea, and we make mouth guards for TMJ, facial pain disorders. So I think that particular familiarity with that treatment approach is part of that reason as well.
I'm sure you would need additional training for that.
Yes, so orofacial pain, my specialty, just recently, within the last year, became recognized as a specialty. It's been around and been in the process for literally decades, but in the height of the pandemic in late March, we became a recognized specialty of the ADA, American Dental Association, and that included sleep apnea is one of the things that we do treat. There are board certifications. I'm proud to be one of the few people really in the country, one of maybe a dozen people in the country that's board certified in both sleep medicine and orofacial pain, and able to combine those two.
How do you diagnose and treat sleep apnea?
So I, as a dentist, do not diagnose sleep apnea, and I want to be clear on that. The diagnosis has to come from a physician, a sleep board certified physician, who may conduct a sleep study that's done either at home or in a sleep lab, which is sort of like a little hotel room where a person spends the night and has all kinds of monitors hooked up to them, and they measure breathing and other things. And then as far as treatment, the most common treatment, the treatment that will most likely be applied first, is the CPAP machine, which is not something that I do, but it is a very well-established, proven appropriate treatment for sleep apnea. A lot of people have a hard time with it or don't want to use that and want to have alternative options, and that's where the oral appliance comes in.
Sleep apnea can definitely affect your day-to-day. What type of quality of life does the impact have if you have sleep apnea?
I think it's hard for people to imagine just how detrimental it is not to be able to sleep well. Sleep is one of those things in life that just it casts a cloud over everything in your life, how you feel, how you think, how you interact with other people. Not sleeping well is just a very great burden on the people that unfortunately are living with that. And in many ways, things they don't even realize, how it affects their thinking, their reaction time, and so on. The risk for car accidents, the risk for workplace accidents, the anger issues and everything that, I mean, just about every medical and health issue you can imagine will relate to insufficient sleep. And so the effects are just, unfortunately, very, very widespread.
Absolutely, sleep is so important. Now, what are some early signs of sleep apnea? Would a headache first thing in the morning, is that a warning sign?
That certainly can be. When a person has sleep apnea, their blood oxygen typically drops to what really would be dangerous levels, and that can certainly relate to headaches and other aches and pains. Just about any medical condition a person has is likely to be worsened by having sleep apnea. Some of the signs you asked about, snoring is certainly a common sign, although not everybody who snores has sleep apnea. Witnessed apneas, that's what we call it when somebody visibly struggles to breathe or seems to stop breathing. You may have seen that in a spouse or a family member, and that could really be a very important warning sign.
Now, I know you have special mouth guards to help treat sleep apnea. How do they differ from a CPAP machine?
Sure. So a CPAP machine is a machine. It's a machine that blows air, and it sits next to the bed, and there's a hose and a mask involved, and it helps to open the airway so a person can breathe. And I know that sounds like a lot, and it is, but it's a life-saving device. It's a wonderful device for those that can use it. But we understand a lot of people have a hard time with it, and if they have a more mild case, in fact, a mild or moderate case of sleep apnea, it's considered appropriate as a first-line treatment to do either an oral appliance or a CPAP machine.
Right. So a mild case, you'd be a great candidate. I'm sure way more comfortable. Can you show us what that looks like?
Sure. I want to show you first this skull that I brought. If somebody's been trained in CPR, they know that if somebody's not breathing, the technique of pulling the jaw forward to open the airway is part of a CPR training. And that's really where this idea of these oral appliances came from, that if you bring the jaw forward, you can open the airway and allow somebody to breathe better. This is a typical example of just one of many, many different designs of oral appliances that are out there for sleep apnea. They pretty much all function along the principle of holding the lower jaw forward. Many of them will have some kind of adjustable mechanism that allows you to change the position forward and back. Many of them are single piece. This particular one is in 2 pieces. But there's lots of different designs for different purposes, and that's part of the background education of somebody who does this is knowing how to select the right one for the right person.
So would the first step be to see a sleep specialist to see the severity of my sleep apnea?
Yeah. There's a lot of first steps. The main thing is to take a first step. But it can be taken in any number of ways. A lot of dentists have a lot of interest. This has recently become more of a forefront issue in dentistry, and I'm glad for that because it is a very important health consideration. So a lot of dentists are attentive to it now. Bring it up with your dentist. Let them know that there's concerns, snoring, difficulty breathing. Bring it up with your physician, and whomever it is ought to help point you in the right track. You'll probably start with a diagnosis with a sleep physician, and you may very well end up with a dentist who can make you the right kind of appliance if that's the right thing.
Now, people tend to wait till the last minute, especially when it comes to their health. Yeah. Why should I come see you?
That's a great question. The issue with sleep apnea sometimes is we don't know that it's there. We don't give it enough credence, and we just attribute that fatigue, that feeling of tiredness, to so many other things that could be going on in your life, and it just seems ubiquitous that people have sleep issues. Well, you'd really be doing yourself a disservice not to investigate that. When there are options, there are very reasonable options to make one's life better, more comfortable. Same thing with the TMJ that you mentioned earlier. If you're waking up with headaches, if you're waking up with jaw pain, and you have the opportunity to do that for yourself, to do some sort of service to yourself and make that better, I urge you not to hesitate. I think everybody should be living as comfortably and healthfully as they can, and it's wonderful. There's a lot of resources in this Buffalo community for any number of these issues.
Absolutely. Dr. Goldberg, how can someone get a hold of you?
Sure. Well, my office is located in the Dent Tower, where we're very proud to be. It's a landmark location in Amherst, and we have a wonderful relationship with the Dent Neurology Group and the other practitioners there, and a lot of medical groups around Buffalo. We welcome people to our website, facialpainandapnea.com, and of course, you're welcome to call the office and speak to our wonderful administrative staff, 716-636-2222. Try to make that easy for you. We do have a satellite office in Rochester too. There has not been an oral facial pain provider in Rochester other than at the dental school there. So it's wonderful to be able to bring that service to Rochester, and we're happy to set up patients there in the town of Brighton as well.
Dr. Goldberg, is there anything else you'd like to add?
Sure. First, Samantha, I want to thank you for having me on the show and for the value this show is bringing to the Buffalo and Western New York community, letting people know about the health resources here. Like I think a lot of doctors in Western New York, I'm passionate about what I do. I'm proud of what I bring to the area. My goal in creating my practice was to create really the ultimate or the quintessential orofacial pain practice. They're few and far between. A lot of cities the size of Buffalo don't have anybody in that specialty, and I consider myself fortunate to be here. I consider myself very fortunate to have just the best team working with me. It's a great pleasure to see how we together as a team, my staff, clinical and administrative, our nutritionist, our physical therapist, are able to come together for the good of our patients and really create a great boutique, patient-centered experience. So thank you for giving me the opportunity to share that with your audience.
Absolutely. It sure sounds like a great place, and I definitely will be paying you a visit.
Thank you so much.
Dr. Jeffrey Goldberg, thank you so much for being with us here today. It's been a great conversation. Facial Pain and Apnea has offices in Buffalo at the Dent Tower at 3980 Sheridan Drive, Amherst Suite 401. Dr. Goldberg can be reached at 716-636-2222 or online at facialpainandapnea.com. He also treats patients in Rochester at 1655 Elmwood Ave, Suite 100. For the Rochester office, call 585-730-6153. In the U.S., around 12% of people have a TMJ disorder, and about 70 million have a sleep disorder. More than 1,500 fatalities happen every year due to drowsy driving. If either TMJ or a sleep disorder is disrupting your life quality, an oral appliance may be the answer. To learn if you could benefit from this alternative to CPAP therapy, head to the website at the bottom of your screen. A customized mouthguard could be the first step towards getting a better night's sleep. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.